Hello everyone, my name is Jiho Choi, and thank you for taking the time to watch this presentation. Today, I'll be discussing a topic that is absolutely vital in my line of work as a registered nurse in a psychiatric hospital, which is the importance of effective communication. Working in a psychiatric hospital is an incredibly rewarding but also uniquely challenging experience. Communication isn't just a professional requirement, it's the foundation of every therapeutic interaction we have with our patients. It's also the glue that holds our interdisciplinary team together. When communication breaks down, it's not just an inconvenience, it can be dangerous. And that's why learning and applying effective communication strategies has been one of the most valuable aspects of this course. One of the most essential types of communication in psychiatric nursing is verbal communication, especially during change of shift reports. These handoffs are often done verbally between nurses, and the information shared must be both accurate and thorough. The nurse receiving the report typically writes notes based on spoken communication. This process is crucial because it sets the tone for the entire shift and prepares the nurse to anticipate patient needs. Miscommunication at this stage could result in missed medications, overlooked behavioral changes, or even safety incidents. Another form of essential communication is nonverbal communication. In a psychiatric setting, patients are often hyper aware of body language, tone of voice, and facial expressions. A patient in crisis can easily misinterpret these subtle cues. For example, crossing your arms or avoiding eye contact can be perceived as disinterest or hostility, even if it's not your intent. That's why maintaining open body posture, speaking calmly, and using eye contact appropriately is key to establishing trust and de escalating tense situations. I've also learned the importance of written communication, not just in formal documentation, but also through visual tools like flyers, brochures, and signage. In our unit, we provide patients with printed materials explaining their legal rights, such as the details of a 5150, which is a 72-hour hold, or a 5250, which is a 14-day hold. These brochures outline how to contest a hold during a certification hearing and how to access patient advocacy services. These handouts serve as both an educational tool and a legal safeguard, ensuring patients understand their rights and feel empowered in their care. We also use color-coded visual signage throughout our unit. For example, a yellow star next to a patient room indicates they are a fall risk. A red sign indicates a patient is under line of sight observation due to potential harm to themselves or others. Legal hold statuses are also color coded, red for 5150, green for 5250, and so on. These simple visuals allow for immediate, at a glance communication that enhances both patient and staff safety. I also want to highlight how team communication plays a huge role in patient outcomes. Our interdisciplinary team, comprising nurses, psychiatrists, social workers, and mental health workers, relies heavily on daily rounding. I'm often tasked with presenting patient updates during morning rounds when I'm the lead nurse. These meetings are attended by the charge nurse and 6 to 8 social workers. My job is to relay concise, accurate information on each patient's progress, behavior, medication adherence, and psychosocial needs. The social workers then use this information to plan post discharge placement and services. If I omit details or miscommunicate, it can delay discharge planning or lead to inappropriate placements. This course also emphasized the value of adaptability in communication, being able to adjust your communication style depending on the audience. For example, when speaking to a patient experiencing psychosis, I have to speak clearly, slowly, and reassuringly. When speaking to a physician, I focus on clinical data and recommendations. When updating a patient's family, empathy and clarity are key. Being able to shift between these modes is a hallmark of effective communication in a mental health setting and something I continue to work on every day. Conflict resolution is another area we cover in this course that is especially relevant in my job. In psychiatric nursing, emotions run high, not just for patients, but sometimes among staff too. Being able to address misunderstandings professionally and calmly helps preserve teamwork and patient care quality. One technique I found helpful is the SBAR model, which is short for situation, background, assessment, recommendation. It provides a structured way to communicate clearly and concisely, particularly in high stress situations. This course has also made me reflect on how technology impacts communication. Most of our reports are documented electronically. However, some things like patient grievances or critical incident reports still require written, paper based documentations. Having the skills to navigate both digital and traditional formats are essential. Knowing how to organize and format a short report or memo has helped me ensure that my written communication are professional, clear, and effective. Finally, I'd like to touch on the human aspect of communication, something that can be easy to overlook in a clinical environment. Every time I speak with a patient, I remind myself that even if I've said something maybe 100 times, it's their first time hearing it. Empathy, patience, and active listening are not just soft skills, they're survival tools in mental health care. They help patients feel heard, respected, and that emotional connections can be just as healing as any medication. In summary, effective communication in a psychiatric hospital setting is not optional, it's critical. From verbal handoffs and written reports to nonverbal cues and visual aids, each method of communication plays a specific and vital role. The lessons from this course about vocal delivery, structuring messages, understanding your audience, and adapting your style have given me a renewed confidence in my communication skills and an eagerness to keep improving. Thank you for listening, and I hope this presentation has highlighted how powerful communication can be in creating a safe, respectful, and healing environment for both patients and staff. Thank you.